I'm Ashwini from Bellary. I faced a car accident a couple of months before. I don't consciously remember the days I was in the hospital. One fine day when I woke up, I wasn't able to walk. I wasn't able to lift my child. It was just the love of my dear ones which brought me back.
I am Ashwini's husband. Like she mentioned, we met with an car accident. After I came to Columbia, Asia, I realized how major it was. I asked the emergency ward doctors, can I get her back? That time the reply was, it's difficult, but don't lose hope. After 12 or 15 days, she started showing slow improvements, like she was able to open her one eye, she was able to move her one or two fingers, and I was said by doctors that it's a long process, but we are on the right path right now. That is more important, that we are on track. When she started showing slow response, I got feedback from the doctors, from ICU and the neurosurgeon, that now it's time that slowly the tubes have to come out, and physiotherapy and rehab is the thing that can bring her out. Moreover, they stressed that she has to be with her family. That is more required. Total process of exercise and one by one everything started. Making her sit, then making her stand, then making her walk one step, the other the two steps. I was said by doctor in Columbia, Asia, now she is the baby. One after the other step, like how your child is having. Before walking, she started crawling. She crawled for 15-20 days. And all these things I am saying that these are stages. Every stage like a baby has, this will happen for a month. Same happened for my wife also. Today she is walking. All the stages I went through for 15-20 days. Whole journey of my 10 months I have learnt is you just can't lose hope. You just can't lose hope. I went the 20th day I went out of this hospital. I promised Dr. Shireen in the emergency ward, I'll come back with her walking within a year's time. And today we have come here.
When she came to the hospital, she was deeply unconscious and she was not breathing very well. So we had to immediately put a tube into her throat and start ventilating her. And then we obviously did a CT scan of the brain. The CT scan of the brain in case of Ashwini showed what we call as diffuse axonal injury, which means that there are multiple areas in the brain which are all very critical areas which are injured in Ashwini. She didn't have any large clot or a large bleeding or a big fracture which needed any kind of an emergency surgery. She had what is multiple small contusions in the brain in critical areas which needed medical therapy and supportive therapy. So she was immediately started on treatment to reduce the swelling in the brain and then shifted to the ICU. What we have to do is to kind of maintain the patient for the kind of amount of time that they need to recover. This is like kind of a shutdown of the electrical activity of the brain that happens when they have this axonal injury. Axons are actually the connecting strands between the nerve cells. So when these strands are cut or severely stretched, they get this diffuse axonal injury and they do take time to recover. She had a gradual improvement compared to many other patients because of her young age. She did quite good recovery for in a shorter duration of time. The most important thing is to keep stimulating this brain so that those connections are re-established. We're very happy to note that at the end of, say, now it happened in December, now it's 10 months since she is done and she's done a remarkable recovery.